Good evening, Prof.
Prof.
Good evening, sir.
Good evening, sir.
Yeah, good evening.
Good evening, Prof.
Good evening, Prof. Welcome, sir.
Thank you. Thank you, ma. Okay. So we are going to start the lecture for this week, and hopefully we are going to finish tomorrow. And after this course, we will start. You will start the next course. The next course is epidemiology, so it's going to start next week. And after these two courses, you are going to write the exam. You are going to write the exams for the two courses. And as we said earlier, the exams will be MCQ, but we are even expected to give you a take-home exam. I don't know if we have seen that, but if you haven't seen for this week, for this course, I'm going to resend them. Do the take-home exams will serve as their continuous assessment, which is 30 marks, while the MCQ exam will be 70 marks. Last week we started with the history. First, we started with the history of diseases and healthcare. Then we went into the history of healthcare in the main religion, Christianity and Islam. We also talked about the history of medical services in Nigeria. Okay, so today we'll be talking about the history of public health. And as you would have realized, or as you would have noticed, that there is a difference between medical care and health and public health. Medical care treats one patient at a time, while public health is interested in a group of persons, in a group of persons. So we have dealt with medical care. We have dealt with medical care, particularly the control, the treatment, or the history of endemic diseases, which are usually the responsibility of the patient. So now we are getting into the history of public health, which is which has to do with the history of public health. The history of public health, which has to do with the treatment of epidemic diseases, which are mostly responsible for public health practices. Okay, so in the course of history, epidemic diseases have mostly been attributed to three causes: the rot of the supernatural, bad air, and foreign imports. So these three causes of these are the three causes of epidemic diseases throughout history, and we are going to look at them. For most in most pre-scientific societies, they tend to attribute epidemic diseases to supernatural causes. Okay, and those supernatural causes. In all societies, in all pre-scientific societies, including those in our traditional societies as depicted in Nollywood movies, so even among Christians, particularly particularly during the medieval time, when the Christians launched crusades to go and recapture Israel, to go and recapture Jerusalem, because they felt that the plague that was that killed a lot of them was because God was angry with them for allowing the Muslims to occupy Jerusalem. Then the other one is the bad air. Bad air is also another common cause. Another cause another commonly held cause of epidemic diseases, right from the including the Romans. The Romans also had believed that bad smell can cause epidemic disease. Bad smell that can cause epidemic disease. So what the Roman did was they built very good toilets to deal with the bad smell that is the bad smell that comes from fecal matter. So they built good toilets. The Indians, they burnt insects. The Indians burnt insects to deal with this bad smell. While in Europe, that was when plague also resumed, even after their crusade. They attributed it to bad air, what they called miasma. And then, if you look at this, this is the attire. This is the attire of plague doctor of that period, plague doctor of that period. So they got those doctors, because they had to visit patients at home, in their homes, so they had to protect themselves. And of course, if you look at this illustration, you will see the level of the extent they went to protect themselves from the bad smell, including this beak. This bedlight beak they have. This bedlight beak has this bedlight beak has aromatic herbs in it to neutralize bad smell. So they went to great lengths. Remember that the Indians burnt insects. So the plague doctors also did something similar to protect themselves against bad smell. Okay, but perhaps the one that is the reason that is most scientific is the belief the belief that epidemic diseases are caused by foreign imports. That epidemic diseases were caused by foreign imports, and with this belief, led to quarantine. This belief led to the introduction of quarantine legislation, which was first enacted in Ragusa, the modern day Croatia, in 1377, which barring all persons from plague endemic areas from entering the city until they had spent a minimum of 1 month or 40 days in isolation. Okay, so the first town to introduce this quarantine of foreign ships, or the crew of foreign ships. The first town it was first enacted was in Ragusa, Croatia. Okay, was in Ragusa, Croatia. Okay, so with the success achieved in Ragusa, Croatia, other European towns emulated that. Other European towns emulated that the quarantine regulation, and but the northern towns of Italy, Turin, Milan, and so forth, they went ahead to constitute a board of health. They went ahead to constitute a board of health, which was tasked with the responsibilities of determining the existence of plague, establishing quarantine, and issuing health passes. So they even issued health passes to people they deemed to be free of the disease, and for those they deemed to be infected, they isolated them and this board of health, they were also involved in burying the victims of plague, and and other responsibilities that are involved in taking care of the plague. So from Ragosa that did quarantine to the northern Italian cities that constituted a board of health, that constituted boards of health to manage the quarantine regulation. Okay, so the next step in this quarantine was the one done was what John Grant did, because those cities that had the board of health, starting with the northern Italian cities, they were publishing what they call the bill of mortality, showing the number of deaths in their town on a regular basis. They were publishing them on a regular basis, and with that they could tell when plague was taking place, because when plague is on, or when there is any epidemic, there will be an increased number of deaths. So they were making these publications. But this John Grant made further interpretation. He was able to actually predict. He was able to actually predict the mortality. He was able to predict life expectancies based on the prevailing mortality, and he published this in his book Natural and Political Observation Made Upon the Bill of Mortality, and he published it in 1662. So yes, 1662. So John Grant was able to show that it's not just to know the number of deaths, but one could actually go ahead to calculate the life expectancy of persons based on the prevailing mortality rate, based on the prevailing mortality rate. This is still being used. And I'm sure that in demography and in epidemiology, which are going to be taught next week, this guy will also be mentioned. Okay, so with the establishment of the Board of Health, these epidemic diseases, they were able to control these epidemic diseases in European cities. They were able to control these epidemic diseases in European cities until the industrial age. So the industrial revolution in Europe created its own problem. The industrial revolution in Europe created its own problem, because people moved from the rural areas to the urban centers. People moved from the rural areas to the urban centers. And when people move from the rural areas to the urban centers, they often do not have enough money to rent a decent accommodation. They often do not have enough money to rent decent accommodation. So they often reside in slum areas. They often reside in slum areas. And slum areas usually do not have a clean water supply. They don't have good toilet facilities, and they don't have good waste disposal facilities. And because of that, slums are usually very, very dirty. Slums are usually very, very dirty, and of course, smelly. And this resulted in several epidemic diseases, especially cholera and plague. But cholera was very, very incessant, was very, very common. And of course, because of the smell or the stench in these slums, the cholera that was very, very common was said to be a lot of it was said to be due to bad smell, due to the inhalation of the bad smell, until this guy noticed that most of the symptoms, John Snow, he was a general practitioner, he was a medical doctor was a GP, a general practitioner. He noticed that the symptoms were mostly related to the gastrointestinal tract. That's the GI, and of course, cholera is usually associated with frequent passage of frequent stool, watery stool. Okay, so he felt. So John Snow suspected that it is likely to be to be through the oral route, through the mouth, and he suspected that it may be due to the water supply, and it will be due to water supply, and he actually suspected one pump in London called the one pump in Broad Street, London. And yes, he suspected that. And what he did was he removed the handle of that pump, and that led to a reduction. That led to a reduction in the incidence of cholera. So with that, he was able to prove. He was able to prove that cholera, in this case, wasn't due to bad smell, but actually due to the drinking of contaminated water. A little bit of background will be all right, because in London at that period, water supply to London was handled by multiple companies, and they were all taking their water supply from River Thames. London is at the bank of River Thames. So the particular water company that supplied Broad Street actually took the east water from downhill or downstream of River Thames. And of course, you know that in a river flows, so contamination will flow from upstream to downstream. So the contamination will be highest downstream. And that was the reason why the water being supplied to Broad Street, London, was contaminated and led to the outbreak of cholera amongst those that drank, amongst those that fresh water from that pump. I'm sure that Professor Tobin West and others will tell you about this John Snow, because what he did has to do a lot with epidemiological studies, which you'll be taught in that course. Okay, so the situation continued. In fact, this guy, Edwin Chadwick, was also found out. He was a lawyer, but he was able to establish a link between dirty environment and the outbreak of these diseases. Between dirty environment and the outbreak of these diseases. So, of course, Edwin Chadwick didn't have the medical knowledge of John Snow. So when John Snow was able to pinpoint that it was due to contaminated water, but Edwin Chadwick attributed the infection as not only as due to the dirty environment, and I must say that cholera wasn't the only epidemic occurring in London then. There were also plague and plague and tuberculosis and other diseases. So this guy was able, Edwin Chadwick, was able to establish a link between dirty environments and the outbreak of these diseases. And with that, he was when he submitted, because he actually made this connection in the report he submitted. He submitted on the sanitary condition of the laboring population of Great Britain. That was where he made that connection. And with that, he was able to convince a lot of persons including the ladies, including the upper class ladies, upper and middle class ladies, about it. And then they put pressure on the government, and that led to the enactment of the Public Health Act. That led to the enactment of Public Health Act. But before that Public Health Act was established, there was the report of Edwin Chadwick created a lot of enthusiasm amongst people, especially those upper class ladies who were not doing anything, who were bored. They were literally not doing anything because they had maids cooking, washing, doing all the domestic chores, and they were just there, so they were bored. So the fact that so the report of Edwin Chadwick gave them the opportunity to come out of their castle, to come and do work outside, because from what Edwin Chadwick said, he just to clean the environment and the epidemic will go down. So this enthusiasm led to the formation of the first public health associations. So this enthusiasm led to the formation of public health organizations. And I must say that these public health organizations were made up of all and sundry. Anybody that could do something about the dirty environment were recruited as members. So apart from these upper class ladies, they were health workers, they were lawyers, they were engineers, all of them. So that's the Public Health Association at its inception was actually made up of almost everybody. Almost everybody, or everybody who could do something about the dirty environment. So they fought, and it led to the enactment of Public Health Act. So the Public Health Act is considered one of the greatest, or one of the great milestones in the history of public health, because the Public Health Act actually institutionalized the practice of public health in Britain, and by extension, Nigeria and other Anglophone countries. Okay, so the Public Health Act led to, first of all, the establishment of the local board of health, which we can call the health office of councils, local councils, the health office of local councils, and this health office of the local councils were charged with the following responsibilities: the provision of clean water supply, sewage disposal, control of offensive trade, ensuring the quality of food, paving of streets, and the removal of garbage and other sanitary materials. So these services are now called municipal services. They are now called municipal services, and they are still statutorily, even in the Nigerian constitution, they still remain the primary responsibility of local government to provide water, to provide water, to ensure the safe disposal of feces, to ensure the prompt evacuation of refuse, to ensure food safety, and so forth. Okay, so this health office, created by the 1848 Public Health Act, was given these responsibilities. And not only that, the Public Health Act created the office of the Medical Officer of Health. The Public Health Act created the office of the Medical Officer of Health, which is a single individual, usually medically qualified, and is given the responsibility of taking care of everybody in the local council. The Medical Officer of Health was the office of Medical Officer of Health was established in this act. And the medical officer was charged with ensuring the health of everybody in the community or in the council by ensuring that the environment is clean, by ensuring that the environment is clean. So what the medical officers of health did, since they were just a single individual, they recruited and trained sanitary inspectors who are now called environmental health officers, who went door to door looking for dirty environments and then compelling people to take action, okay? To take action. So public health in this era was basically environmental sanitation. Public health activities in this era was basically environmental sanitation. So everybody who could contribute to environmental sanitation were considered members of, or were considered public health practitioners. And these included these upper class ladies who were mostly interested or mostly involved in environmental sanitation in that period. Okay, in that period. Okay, so this practice continued until the germ theory was discovered, until it was discovered that the epidemic or diseases were caused by microorganisms, until it was proven that diseases were caused by microorganisms. So instead of cleaning the environment, public health activities moved to looking for these microorganisms in various environments, in water, in food, in the air, everywhere. So what public health activity, what they were doing there, they were collecting samples and then testing these samples in public health laboratories, which were established during that period to aid the practice of public health. So with this, public health moved from a profession of amateurs to a profession whose practitioners had the ability, practitioner had the ability to carry out bacteriological studies. So it moved. So with the discovery of the germ theory, public health moved from an all-comer profession to a profession where knowledge of bacteriology is paramount. And of course, with this now, these upper class ladies dropped off, and then public health became fully professionalized. So with the discovery of germ theory, the public health became fully professionalized. And the professionalism of public health was even further enhanced with the discovery of vaccines. The professionalism of public health was even further enhanced with the discovery of vaccines. So with vaccines now, vaccines offered public health practitioners the ability to protect the individuals, protect members of the community during an epidemic. Okay, and they used it, in such a way that they used it in compulsorily. They compulsorily immunized or vaccinated people during epidemics. So during epidemics, people were vaccinated, and that were compulsorily vaccinated, and that actually resulted in the control of these epidemics. And in Nigeria, there were reports of roadblocks being mounted, and even when any vehicle, once any vehicle gets to that roadblock, the passengers will be asked to disembark, and they have to show evidence of being immunized, and those not immunized were forcefully immunized before they could continue with their journey. So compulsory vaccination, they did it. They did compulsory vaccination to ensure that everybody is protected during the epidemic. Okay, so with vaccine, they were able to, with vaccine, they were able to control a lot of these epidemic diseases, such that they began to think that all diseases were caused by microorganisms, until some scientists also proved otherwise. Alice Hamilton was able to prove that white lead was responsible for the death of workers that were involved in the canning and glass polishing industry, and he did that in 1910. So, of course, Alice Hamilton was able to prove that it was white lead that was responsible for the death of the workers, or for the illness of the workers, and not any microorganism. And the same thing, John Lind even did that earlier. Did that earlier in 1747, when he was able to prove that scurvy, which was a problem with sailors, was actually caused by vitamin C deficiency, and others like Percival Pott, who was able to prove that the cancers that was common in chimney sweepers was actually due to exposure to soot and not due to microorganisms. So these are some of the examples that proved that was able to convince people of those of the 18th and 19th century that it was that all diseases were not caused by microorganisms. Okay, so when they carried out the immunization and others, they noticed that those coming down with the disease, and even those dying from those diseases, that the rates at which these diseases kill people, it's not kill people. The rate at which the diseases kill people is not uniform all across the socioeconomic class. The rich seem to be protected and are not dying as not die and are not dying as much as the poor. So this led them to find out that socioeconomic characteristics like age, like income, like occupation, like socioeconomic status, like even at times religion, can actually influence who gets infected and who dies from a disease, and this led to the type of medicine called social medicine. Social medicine is aimed at ensuring the control, ensuring that these socioeconomic situations do not continue to exist. And that is also what we do in public health. Yes, we try to use two principles to ensure that equity and social justice. Equity meaning that when we are giving in public health health resources are shared not equally, or not made to be provided on a cash and carry basis, but resources are provided to people according to their need. So people that need much are given much, and those that need less are given less. Because they can actually cope with the less they have been given. With the less they have been given. Okay, so Okay. Okay. So that is that. So we have gone through this history of public health. Yes, right from the traditional or the early times when these epidemic diseases were attributed to the rot of the supernatural, and then up to when it was considered as bad smell, to Ragosa when they started quarantine, to the northern Italian cities that were the first to start to create a board of health, and then to the industrial age that created another problem with slum settlement, to Edwin Chadwick, that was able to prove the relationship between dirty environment and the outbreak of these epidemics, resulting that galvanized everybody in the society, including the upper class ladies who became interested in environmental sanitation and were actually the first public health practitioners. They achieved success until the jam theory came. When the jam theory came, they abandoned they de-emphasized clean environment, but instead they were collecting samples and testing them in public health laboratories, and then determining which condition is hygienic and which is not. And with this knowledge, or with this use of bacteriology, it discouraged these upper class ladies. And then when vaccine was discovered, it provided public health with a powerful control tool for the control of these epidemics, and they used it zealously, because they immunized everybody, including those that weren't interested, weren't too receptive to immunization. And that led to a massive reduction in the epidemic diseases, such that people began to think that all diseases are caused by microorganisms, until people like Alice Hamilton, John Lind, Percival Potts were able to prove that there are other causes. Okay. But but they continue to make progress. They continue to make progress, but this progress were said to be much lower in people of lower socioeconomic class, and that led to social medicine, whose objectives are to ensure that the poor has access to the needed health facilities or health services. Okay, so that's a summary of what we have discussed. I don't know if there's any question or comments before we go to these international organizations, history of international organizations. Do we have any question, any comments? Okay. Ebele.
Okay.
Ebele, yeah.
Good evening, sir.
Good evening.
Thank you for the lecture. So I wanted to ask, under vaccination, there's a place it says that, it is normally used as a tool of last
resort.
Yes. So I just wanted to ask, like, in the long run, is there, like, will it ever even be possible to maybe change this approach? Because sometimes I think science has shown now that some of these epidemic prone diseases, the use of vaccines can contain them, especially maybe when it is administered, say, for example, to children at younger ages.
Yeah. The thing is this, that in an era, in a world where people believe that they have a right, yes, you don't want to force people. Because if you force them, you will, you will not gain their support. You won't get their support. And in public health, the public health practitioners will always want to get the support of members of the community. And that is why what they call the community participation. It is very, very important. So that's why you just leave the use until it is absolutely necessary. You will leave the use. But there are also subtle ways of encouraging people to get immunized. For example, for children, they will insist, or it's made compulsory that before a child is registered to in primary school, that child must show evidence. Yes, must present his or her immunization card. That is a subtle way of doing that. And of course, there are also certain services like pilgrimage. When polio was common in northern Nigeria, the Saudi authorities made it mandatory that pilgrims coming from Nigeria must be vaccinated, including adults. So some of these things they use to compel people to
get vaccinated.
Yes, yeah.
Okay. Thank you, sir.
Thank you. Hello, Wally. Cyril.
Good evening, sir.
Good evening.
Thank you very much so far, sir. But sir, a little bit, maybe my network was acting up when you talked about the jam theory. I wanted to know the year it was stated and
Unfortunately, you won't get any year. Right?
Okay.
Because people were working in multiple places. Multiple places, and then and then it became obvious that germs were actually responsible for these diseases. Okay.
Yes.
Yeah.
Okay. Thank you.
Okay. Yes. Hello, Kathy. Hello.
Yes, Prof, I'm here. Okay.
Yeah.
Good evening, sir.
Good evening.
Okay. I want to know or to find out, because you said public health moved from the usual belief of the environmental sanitation to
yes.
like
When we are talking about miasmic.
That diseases are being caused by microorganisms. So is it that it negates completely that environmental sanitation could also breed microorganisms, or maybe it helps in the spread of it?
No.
The jam theory.
Yeah,
That it just
no. Actually, smell. We have this sense. Okay, the senses. Senses are there for us to perceive the environment. It's for us to perceive the environment. Actually, that smell, any smell that is repulsive, we are hardwired to know that they are not good for us. When they smell badly, it is indicative to us that thing is not good, or will cause us harm. But that is non-scientific. That is non-scientific. And I also must say that environmental sanitation came from the word sanitize, and to sanitize, to make clean. Is to make clean. So the thing there is that I think is virtually the same thing, because when the germ theory came and they were collecting samples and testing them, they began to set limits, targets. For example, they will say that a water is clean for drinking if it contains less than 10 E. coli per deciliter. So they set those standards. they set those standards. So they did that for milk, they did that for food and other things. The only thing is that the only problem is that previously they were relying mostly on their sense of smell. But right now, but with the germ theory, they were now testing specimen or samples, collecting samples and testing them for the presence of the microorganisms. So they weren't using their sense of smell, but they are now relying more on bacteriology, counting the bacteria in the samples. Okay.
Okay, sorry, Prof.
Yes.
Maybe I don't know whether my question didn't actually go well. Because, normally when you're trying to protect an environment, talking to people on jams, hand washing, after toilet and the rest. So it's all about hygiene, which is more of sanitation. So, and the essence of doing this is to protect people from contacting microorganisms from those environments. So my question is that, so should we say that environmental sanitation also aids in public health as much as this germ theory? Because the germs too, you also advise people to wash hands and do all of that.
Yes.
I think
yes, I think they are basically the same. They are basically the same.
Okay.
They are basically the same because but the other one, the miasmic, that is environmental sanitation. They relied on the sense of smell, but this other one, they are counting the bacteria. Yes, they are counting the bacteria. Instead of relying on the sense of smell, they are relying on the total number of bacteria in the sample. So they are basically the same. Yeah.
All right, thank you.
So, yes. Okay. Hello, Chi.
Hello, Prof.
Yes.
Good evening, sir. Thank you for the lecture so far. My question is different from the lecture. It's because I came up. I wanted to join around 6, but I was searching for the link to this Zoom. I couldn't see it. So I don't know whether we have a different group where the links are posted or what. I don't know.
Okay. Yeah. No. Okay. Are you on the platform?
Yes,
WhatsApp.
I'm on the general WhatsApp group, but I don't know whether, because I didn't see any link there.
Okay. Perhaps we have to be.
It took me over 10 minutes to join.
We have to pin it. I'll tell them to pin it or to refresh it. Yes.
Sorry.
Okay. Yeah. Okay. It's all right. That will be sorted out. Hello, Kenneth. Kenneth Onyema. Hello, Kenneth. Hello, Kenneth. Okay.
Prof, thank you so much.
Yes.
Right. Good evening, Prof.
Good evening.
Thank you so much for the wonderful. Prof, can you hear me?
Yeah, but you are breaking, but continue.
So thank you for the wonderful. Yes, Prof, I can hear you. I can hear you, Prof.
Yes, go on.
Can you hear me?
Yes, go on. Hello, go on now. Oh, okay, it's network. Hello, Success. Agama. Hello, Agama.
Hello, sir.
Yes.
Good evening, sir.
Good evening.
Okay, sir, sorry. I want to add, there's something you said concerning the other causes of disease. You said Alice Hamilton was able to prove that what caused the illness.
Yes, it's white lead that was poisoning the workers involved in the canning and the glass polishing, working in canning and glass polishing industries. So of course that isn't a microorganism. And others like John Lind that proved that it was vitamin C deficiency that was responsible for scurvy and not microorganisms. Eh? Okay.
Yeah. Then perceive and the other name perceive pot be something
That
like
one
that.
is yes, don't worry. I think you have to you'll still find it on the slide.
Okay.
Yes. Hello, Maria. Hello, madam.
Yeah, hello, Professor.
Yes.
Good evening.
Good evening.
Yeah, my question is with respect to what you talked about regarding social medicine and equity.
Yes.
Yeah, we've seen the role that how public health has evolved from the mystical beliefs to the scientific aspect of it. But I haven't heard any mention of nutrition. Does nutrition have a role to play in terms of?
Yeah. You know, we're saying that when they controlled, or even as they control the epidemic diseases, they still noticed disparities in the population. Yes. For example, the rich were not as affected as the poor, and even especially those the poor living in those slum settlements. And one of the reasons is actually nutrition. One of the reasons actually nutrition, because with nutrition you have better immunity, and with better immunity you are able to fight off disease. In fact, probably I have to refer to this guy Thomas McKeown. McKeown. He wrote a book and called it Medical Nemesis. And in that book, he was able to show that mortality rates, the mortality death from these infectious diseases were already falling in Europe due to better nutrition and environmental sanitation, and not just medical intervention. You know, yes, and not just medical intervention, including antibiotics, including antibiotics. So because a lot of times people think that that only hospitals or good hospitals, if possible, or possibly the best teaching hospitals, that it's only when you have them that people live longer, that people can live longer. But this McKeown was able to find out that in Europe, they were able to tackle these deaths, these epidemic diseases. The epidemic diseases weren't causing as much death as they were because of environmental sanitation, because of better feeding, better nutrition, better nutrition. Okay.
So on the other hand, as a follow-up, could we also say that nutrition is also, just like we have occupational health and the others, is it also an integral part of public health?
Yeah. It is. Anyway, we even have a course, public health nutrition. And then I am also one of those that we are trying to popularize what we call the medicalization of food. Yes, food can be medicine. In fact, in Asia, in China and those a lot of those Asian countries, they consider their food as their medicine. The food as their medicine. And with the rising prevalence of diseases like diabetes, yes, food is even becoming more important in the management of these diseases. Okay?
Yeah.
Okay. Hello, Kenneth. Kenneth Onyema. Not, okay. Hello, Maxwell Brenda. Brenda Maxwell. Hey.
Prof.
Yeah, good evening. Hello? can't hear Brenda. Okay. So Chizoba Amechi. Hello.
Good evening, Prof.
Good evening.
Thank you very much for the lecture. I was having network issues at the beginning. You said we are going to have 70% from MCQ and 30% from what, please?
Yeah, the take-home exam. I think if you have not seen it, the take-home, I think I will have to repost it. Just answer and then upload on the portal. Okay. Okay. Hello, Precious. Hello, Precious. Okay, Precious is not responding. So we can just move on to the next, which is the history of international organizations. So we talk about international organizations like the WHO and other international organizations. So with the industrial age or the industrial revolution led to the manufacture of several goods, plenty goods, and these goods were exported all over the world. And the world was almost has opened up with colonialism. But this increased international trade resulted in frequent outbreaks of epidemic diseases. Because actually, when you introduce a disease into a population where they do not have immunity, that's a tendency for an epidemic to occur. So that was what was happening. That was what was happening. Even when the British came into Nigeria, it led to an explosion of several epidemic diseases, especially smallpox. Smallpox killed a lot of persons as the British colonized Nigeria. Smallpox killed a lot of persons, especially killed so many persons in Yoruba land that the Yorubas deified the smallpox and called it a Shupono. And of course, with his priests and priestesses and other worshippers. Okay, so because of that, international hygiene conferences were organized to look at ways of controlling epidemic diseases without compromising international trade. So these international conferences, called the International Sanitary Conferences, were organized regularly to look at ways of controlling these international spread of diseases without compromising trade. Okay, so several of them were formed, including the International Office of Public Hygiene, which was established in Paris in 1907. And after the First World War, the League of Nations was established, and League of Nations had its own health office that took over the responsibility of the other international organizations. That took over the responsibilities of these international organizations. Okay, so but even with the formation of the health office of the League of Nations, they weren't able to achieve much. They weren't able to achieve much because of politics and the ulterior motives. Because those that were producing goods, those that were producing a lot of goods, like Britain, they want international trade. They want to sell their goods, whereas people in the countries receiving those goods, they want to protect themselves from these these diseases that are causing epidemics. So the health office of the League of Nations didn't achieve much. They didn't achieve much. But they didn't achieve much But international NGOs like Rockefeller, the Rockefeller Foundation, they made significant progress. They contributed significantly, especially in those early days of the jam theory. John D. Rockefeller was the richest man of that period, was the richest man in the 19th century, and he was an oil tycoon. He was the richest man, and he founded the Rockefeller Foundation. And he brought, with the foundation, was able to fund research and discovery of disease agents, especially in tropical countries, and that led to the discovery of yellow fever. And yes, that led to the discovery of yellow fever and other tropical diseases, yellow fever, malaria, hookworm, and other tropical diseases. And so the Rockefeller Foundation didn't just stop there. They funded the establishment of the schools of public health. Schools of public health in London, the London School of Hygiene and Tropical Medicine, the John Hoskins School of Public Health, and the Harvard School of Public Health, all received funding from Rockefeller to train people to train people in the management of these tropical diseases, tropical diseases. Okay, so Rockefeller, we have to thank Rockefeller, because he was the one that funded the research that led to the discovery of several of these malaria-borne diseases, like mosquito-borne diseases like malaria, like yellow fever, like Zika. In fact, Zika, if you look at the discovery of Zika, Nigeria featured significantly. Nigeria featured significantly. And not only that, they were discovered, and he also funded the development of vaccines for these tropical diseases. Okay, so just fast forward the present. Bill Gates was the richest man. He made his money, of course, from computers. He made his money from computers. Right now, he is recreating what Rockefeller did. So he's funding research into tropical diseases. And why is it important to fund the tropical diseases? They are even called neglected. Tropical diseases, because drug companies are not ready to conduct research leading to the discovery of drugs for them, because those in tropical countries, they have very, very low purchasing power. They don't have, and so they can't pay. They can't pay good money for any developed drugs, and that's why drug companies are not interested. And that's why instead they will go and spend billions in looking for a treatment for Alzheimer's syndrome, or even the one Pfizer succeeded for impotence, impotency. Impotency, yes. So they would rather spend that money because they can charge a premium. They can charge a premium in developed countries where people have money to pay. So that's why we have to commend Bill Gates. Bill Gates is providing funding for malaria research, especially the development of the malaria vaccine, and it's also providing money providing money for immunization through the Gavi Foundation. He's not the one providing it. He's not the one providing immunization directly, but he's a major funder of Gavi, which is the Global Alliance of Vaccine Initiative that is responsible for provision of vaccines, including the childhood vaccines. So that the people that made it, that is Bill Gates is one of those that have made it possible for children in Nigeria and in Ghana and in other West African countries to be vaccinated free of charge. Okay, so, and he was also instrumental in the development of the COVID-19 vaccine. And when the vaccine was, those vaccines were developed, he also provided money so that we can have vaccines, so that we can be immunized. Okay, but unfortunately, a lot of people are accused him of having ulterior motives, and that accusation, of course, most of them are, in fact, all of them are unfounded, because people don't appreciate or cannot wrap their minds around the fact that somebody can help you without expecting anything from you. Yes, without expecting anything from you. And that is the reason why they will think that, oh, the fact that he's spending his money, he may not be spending his money just like that. He may have ulterior motive, and it is unfortunate because he's doing that. Yes, yeah, perhaps even as he may not be a good Christian, but he believes that we came into this world with nothing, and with nothing we shall go. And probably that is the reason why he has decided that he will give out 99% of his wealth before I think was it 2045 or so. So yeah. Okay. So we get back to the UN organizations. We stopped with the Health Office of the the League of Nations. So the next one is because the League of Nations didn't succeed in stopping World War II. So when World War II was fought and won, the world once again vowed never to allow war to take place. Never to allow war to take place. And they established the United Nations to ensure that. And the United Nations, knowing in recognition of its mandate, adopted Isaiah chapter 2, verse 4 as one of his mottos, as his mantra. And of course, it reads, "They shall beat their swords into plowshare and their spears into boring hooks. Nation shall not lift up sword against nation, neither shall they learn war anymore." So the objective of the United Nations was to stop war, promote international friendliness, international cooperation, promote friendliness and international cooperation. Okay, that was what they did. And following this, other UN agencies were established along that line. The WHO was established in 1945, and by 1948, it published its own constitution. The WHO then published its own constitution, and that constitution that came into force in 1948 define health. Previously, recall that the health office of the League of Nations, they were mostly interested in preventing international spread of disease without compromising trade. But WHO in its 1948 constitution defined health very broadly, defined health as a state of physical, mental, and social well-being, and not merely the absence of disease. So this, I can say that this is an omnibus definition of health, and brings into healthcare almost everything under the earth, including poverty alleviation, including poverty alleviation. Because so healthcare is not just about attending to the physical body. You have to even attend to the mental health of the person. Mental health of the person, and even the relationship, social well-being, even the relationship between two persons. You have to also work on. Okay, so and that is what we have to also, as public health practitioners, we have to note that we are public health practitioners. Our responsibilities do not just end in preventing or treating diseases. Our responsibilities extend to improving the working condition of workers, improving the interactions between individuals in communities, in ensuring that people have a peace of mind, or people are strengthened enough to deal with the stresses of life. These are our responsibilities. It's not just the physical health of the individual. And anyway, we also know that probably why WHO chose these broad definitions, because in that 1948, there were a lot of social issues. People came back, men came back from the war front. Of course, they left their wives, and a lot of things happened. The mental health was also a problem. So I'm sure that post-traumatic stress disorder was very, very common, because if somebody has witnessed a horrible experience, he or she will usually have flashbacks, and will go into panic attack. And at times, the panic attack can result in problems. Okay, so that's why mental health became, WHO had to include mental health and some other things. So, but I must say that WHO has also done well, in spite of the fact that shortly after its inception, the Cold War broke out between Russia and the West. But in spite of that, WHO was able to contribute to the manpower development of the colonies that are now independent nations. They were also responsible for the convening of the Alma-Ata Conference in 1978 that led to the primary health care and others. So there are also other UN organizations charged with different responsibilities. We have to also note them. For example, the UNDP, United Nations Development Program, they are charged with they are involved in the provision of technical and economic assistance to underdeveloped countries. So the UNDP provides economic assistance to developed countries. And they also have because of that, the United Nations Development Program They are aimed at the focuses on their focus is on or their focus are on poverty reduction, HIV/AIDS. They are interested in HIV/AIDS mostly because HIV affects the productive age group. So they are interested. That is the reason why they are interested in HIV/AIDS control, to ensure that the productive age group are kept strong enough to continue to generate wealth. Okay. Then we have the International Children's Fund, UNICEF. It was originally established as an emergency fund after the Second World War to provide food and health care to children, in the aftermath of the Second World War. But right now, it is no longer an emergency fund. It is now a permanent agency of the United Nations. So even when it has dropped international and the emergency in its name, it still retains the acronym UNICEF. It still retains the acronym UNICEF. Okay, the United Nations Population Fund, they are interested in their desire is to ensure that every pregnancy is wanted, every childbirth is safe, and every young person's potential is fulfilled. So United Nations Population Fund is therefore interested in provision of family planning services to ensure that people have only children they want, to prevent the to ensure that people have the resources to prevent unwanted pregnancy. Then the Food and Agricultural Organization was set up to assist, especially developing countries, on how to modernize their agriculture, to improve food production and to ensure food security. While the World Food Program, another agency of the United Nations, charged with providing food to those who are unable to produce or to pay for their food. So the the World Food Program, their responsibility is to provide food, especially in famine and war, in famine and war. So they make food available in crisis situations such as famine and war. For the International Labour Organization, they are charged with their UN body that deals with labor problems, labor issues. They set labor standards and they try to protect workers. They set labor standards and they try to protect workers. Then the United Nations Environment Program, they are tasked with the responsibility of assisting developing countries in implementing environmentally sound policies and practices. Okay, for example, during they were the people, the United Nations Environment Program were the people that conducted the Ogoni study, and they are now involved in, they are collaborating with HIPREP to ensure the remediation of the affected areas. Okay? Okay. So the other thing we have to talk about is the food aid, is the international aid. And this is very, very important because a lot of us don't understand why countries assist each other. Why countries assist each other. Although assistance can be seen as it gives a good image of that country. But most times international assistance are given because the donor countries also benefit. Because the donor countries also benefit. And the reason why
Sorry,
they
Prof.
benefit.
Sorry, Prof. Sorry, Prof.
Yes.
Prof,
Hello,
please.
Kathy.
Yes, at some point, the volume is actually not, it's quite tense. I know that you can't consistently be on the.
Hello. Okay, it's all right. But you can hear me now.
Please use your.
Yes, it's better now. Thank you, sir.
Okay. Okay. So, so the other one is the other one is the international aid. So, so the international aid. We have to probably just to explain why countries give others aid. And I must say that the main reason, apart from the fact that it boosts the image of the donor country, but also because the donor countries, they also benefit. And the way they benefit has to do with the concept of global public health good, the concept of the global public health good. And the global public health good, or the public health good, is defined as things used by an individual that benefits not only the individual, but also other members of the community, country, and even the world. Okay? So in other words, it's something that an individual use that benefits the other persons. Other persons in the community, and the, okay. I will probably give an example. Let's give an example of the insecticide-treated bed nets. Insecticide-treated bed net benefits the person sleeping under the net, but it also benefits persons sleeping outside the net because it is a giant trap. It's a trap. Usually the mosquitoes will see somebody to bite, but when they come into contact with the net contains insecticide. When they come into contact with the net, they either die or get so irritated that they fly out of the room, and in the process they can even die. So their lifespan is reduced. So it means that the person using the net has benefited. The person sleeping outside the net has benefited. The other members of the community has benefited because the mosquito that came into contact with the net would surely, if not die immediately, would have lesser, shorter lifespan, probably, shorter lifespan, and therefore there is reduction in the number of mosquitoes that can transmit malaria in that community. Okay, the same thing has to do with immunization. So if you are immunized, it means that you won't have the disease. And if you don't have the disease, it benefits you, but it also benefits others because you will not, since you don't have the disease, you cannot transmit the disease to others. You cannot transmit the disease to others. In fact, if you have been immunized with a live vaccine like polio, you can shade. The stool can contain even those live viruses, and anybody that comes into contact with them will get infected and get immunity from the live virus. So that is the reason, and that is the reason why these developed countries, they are willing to fund. They are willing to pay for immunization, but they are not willing to pay for, say, other vaccines like the HPV vaccine that protects against cancer, because a person with cancer doesn't spread the disease. A person with cancer doesn't spread any disease. A person with cancer doesn't spread any disease, and that's why they don't. Most developed countries don't. Most donor countries don't pay for things that they will not benefit from. Okay. Okay. So let's Okay. I don't know. I don't know. We can take a question, or we can take questions. Any question? Okay. I don't know if these hands are for this section of the lecture. Okay. Yes. So yes, we can go to, yes. Okay, I know. Okay, Thomas, you can start.
Okay. Thank you so much, Prof, for the presentation. So for the lecture, so please, I just want to, I need further clarification and even possible more example on this last concept you just treated now, the global public health. Good. Yes, if you can explain more with other example, I would really appreciate, Prof. Thank you.
Okay. Anyway, it's also give you that. I've given you that concept. Anything that someone can use that benefits that individual and benefits others in the community. I want me to give. Okay, let me give you an example of contraception. That is another thing that these developed countries, they also provide us. And people have said a lot of things about it. The fact is this, that if you have lesser children, it benefits you. It benefits you because you'll be able to cope with them. You were able to cope with them. Even our country will not want you to get more than 5 children. And that's why if you are registering for even your tax relief, you can only get a tax relief up to a maximum of 4 children. And after that, nothing. If you have 20 children, no way. You'll be left alone. Okay, so it benefits the individual. How does it benefit the country or the community? It has to do with the resources, competition for resources. Competition for resources. Yes, competition for resources. The more, they used to say that if a country, why we have unemployment is because our economy is not growing, is growing at a rate that is less than our growth rate, our population growth rate. Our population growth rate. So if our economy is growing in such a way that is able to cater for those coming out seeking employment, there won't be any problem with jobs. There won't be any problem with jobs. And if you have a lot of children or a lot of people, NFA, what we used to call NFA, no future ambition, no job, they can go violent. As they used to say that an angry man, a hungry man is an angry man, and can lead and can cause trouble. Can cause trouble. And then what of the developed countries? What of the developed countries? They are afraid that they are talking about immigration. They are shutting down their borders. They're shutting down their borders because a lot of persons are coming into their country and creating problems for themselves. Creating problems, outpricing a lot of persons. Although in those developed countries, they have a minimum wage, and you cannot. It's an offense to pay below the minimum wage. But yes. But okay. At least now, some of those jobs that they cannot do, like caregiving, they have left it for those for people. Yeah. Okay. So that is an example. Contraception. It benefits the individual. It benefits the country. It benefits the whole world. And of course, the other thing to add is that the earth doesn't have the resources of the earth is not. The capacity to support the human population is not unlimited. It's not unlimited. Okay, I'm sure that you must have heard of Thomas Matthews. As far back as the the 17th century. He predicted that the world will soon run out of the ability to feed everybody on earth. Okay, so all those things are some of the reasons. Okay, so I'm sure you can think of extra ones. Think. Okay. Hello, Madam Maria.
Okay. My question
Yes.
is directed to, you talked about philanthropy, the role of
Yes.
philanthropy in the development of global public health.
Yeah.
Examples of Rockefeller and the like, Bill Gates and the like. Now,
Yeah.
what has been contribution of African philanthropy to public health? We have people like Dangote, we have the Mo Foundation, Tony Elumelu.
Yeah. Yeah, I think they are. Yeah, they are at least at their level. Because there are also other philanthropists. Yeah, but at their level they are. But of course, somebody like Bill Gates is doing it at a higher level. 99% of his $200 billion wealth will be given out between now and 2045. But Dangote is also helping out. Remember when polio was rejected, vaccination was rejected in northern Nigeria, and polio they started discovering more polio cases. Dangote worked with Bill Gates and then the Kick Out Polio campaign to reintroduce, to get people, to get those religious leaders to buy into the polio vaccination campaign. And he's doing well. And recently, in fact, he's actually the go person, the contact person of Bill Gates when it comes to Nigeria. I think recently Bill Gates was in Nigeria and he was even given a national award. And it was Dangote that took him. So they also have their own. They also have their own foundations, and they're making their own contributions. Okay.
Prof, I would suggest that you should encourage him to also donate 99% of his wealth.
So yes. Anyway, but he's trying. I think perhaps he's trying, but it may not be in research or vaccine. But you know that our own case now is poverty, and I know that he has built a very big university in Kano, and is funding it. I'm sure that that university will be almost like a tuition free, but it's also providing food aid, and other things. At least he's better. Dangote is even better than Elon Musk, the richest person. His own is to shoot rockets. Shoot rocket and cause trouble. So yeah. Okay, madam. Hello, Ikanem. Imobong.
Good evening, Prof. Thank you so much for the lecture so far.
Yeah.
I want to speak about the public health good and the example you give. That's in line with vaccination. So I think I would rather say the benefits for the vaccination is herd immunity. That's looking at the
Yeah. That is the that is it. You nailed it. You nailed it. Herd immunity.
Yeah, because if you know how the polio disease is, people come in contact and become paralyzed.
Yeah.
Not just about coming in contact with the live vaccines, rather achieving herd immunity in the community.
Yeah. Yes.
Thank you.
I'm sure that the others should be able to Google herd immunity. It's such that if a lot of persons have immunity against an infectious agent, that infectious agent may not spread because it will be bouncing. It will be getting to people that are already protected. And I like that. And yes, when I hear about herd immunity, I also know something about charity. And then, of course, the Bible reading of that in the when 2 or 3 are gathered, that you'll be protected. Yes. Augusta Oluchi.
Good evening, Prof.
Good evening.
Thank you very much for a wonderful lecture. So, sir, I want to ask question about international aid, especially the USAID.
Yeah.
From recent news, we've heard that they are withdrawing funds for HIV and AIDS medications. So I want to now ask in the case of withdrawal of funds, not able to pay for such drugs, especially to our country that we have low funds. So what is now the role of the public health practitioner in this situation, where foreign country withdraw their funds or their aids, especially in the case of HIV and AIDS medications?
Yeah, okay, that is the thing. Unfortunately, most of these services are paid for by these developed countries. Most of them are paid for, and then in America they have changed, because we also have poor people in America, and they are saying that it's America first. That instead of giving out this aid, they would rather use it to take care of those poor Americans. That is the policy. So which means we are left alone. We are left alone to deal with our own situation. Our own situation. And the thing is that it is painful, because the growth area, public health, a lot of people, including some of people in our programs that have run our program, done our program in over the past academic section. They are, most of them are employees of these NGOs, and a lot of people our graduates find work in these NGOs, and they pay good money. They pay good money. And right now, with these right-wing people, they are cutting costs everywhere and withdrawing aid. So it means that the countries, they have to take over the responsibility. I know that even the Nigerian government made provision 5 billion to continue to see how if they will continue to provide HIV drugs and other things, and then they are also thinking of absorbing some of these people in these NGOs, but it will be difficult. It will be difficult. Okay.
Thank you, sir.
Yes. Hello, Maxwell Brenda. I hope we'll be able to. Yes.
Good evening, sir.
Good evening.
Hello.
Yes. Good evening.
Good evening. Sorry, I had the breaking transmission earlier. Sorry, I would like to take you back to the first session of the lecture.
Okay, go on.
If you don't mind. Okay. From your explanation, I understood that the germ theory debunks the miasma theory. Does it mean that the miasma theory is false?
No. I wouldn't say that it debunks, but it's just a progression. I was just saying that we are naturally wired. We are created with senses. The sense of sight, the sense of smell. It's the sense of smell that we are programmed to run away from things that are foul smelling. Eh?
Yes.
And those
Yeah.
things that are foul smelling have been found to also be disease causing. Eh?
Okay.
So what they found, what they were doing in the early public health was they were using their sense of smell in the practice of public health. So anything that smells, they will believe will cause ill health.
Okay.
And then they will do something about it,
Okay.
including fish. They had to even set standards. So those people, sanitary inspectors, they were even taught how to identify fresh fish and then a fish that is getting
Going
rotten.
bad.
Yes, going bad. Looking at the at the eyes, and all those things. But the germ theory, they went further than that. They weren't using the sense of smell. Rather, they were taking samples and then testing the samples in the laboratory, identifying the microorganisms responsible for the foul smell, and then do something
Creating a preventive
about
measure.
it. Yes, yes, that preventive measures are even usually sanitation. For example, if water is contaminated with feces, if it feces, the miasmic theory, when they are using miasma, they will just look at it and probably smell it. But with the germ theory, they will analyze it and then count the number of bacteria in it. And that is what they were doing there. Okay. Hello, Fatima. Hello, Fatima.
All right. Thank you.
Okay. Hello, Fatima. Okay. She's not responding.
Sorry, sir, I was talking with a
Yes.
muted mic. No,
Okay.
sir, sorry, I was talking with a muted mic.
No problem.
Good evening, Prof. Thank you so much, sir, for the lecture as usual. So I was just making my own contribution, particularly following the question around what to do as a health practitioner in the new era that we find ourselves. I think basically still following the principle of herd immunity and the public health good was the HIV response, because we know that in HIV medicine, when you treat one person who achieves viral suppression, you automatically treat the next person, because when viral load is not detectable, transmission is low. The transmission rate is very low. And so you are already treating the patients of the future when you treat the index HIV patients. Unfortunately, when we have international politics mixing with health, the people who make the policy might not always have, maybe access to such an information that indirectly it's also a good to their own people to continue to respond to epidemics, of social impact such as HIV. So that's on one side. And I also think for a country like Nigeria, when the message by especially the public health practitioners ourselves give the impression that HIV care or HIV medicine is free just because somebody else is picking up the bill.
Yes, it's very, yes.
So this might just be a lesson for us to be able to responsibly, package the public messages, the health messages, the pep talks in the future. To know that if someone is paying the bill, it's not free. I remember in the beginning, in the earlier era, even very recently, you see.
Hello? 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 Oh, since we have missed, am I the one with the poor network?
No, it
No,
looks
Prof.
like you may have
We
dropped
can't
off.
actually hear
I
her.
hear you.
Okay.
I think it's
Okay.
our network that is bad.
Yes, yeah. Okay. It's all right. I think she will come up. She was providing very good information. Okay. Hello, Peace. Peace. Hello, Peace. Peace, are you there?
Yes, I'm here. Good evening, sir.
Good evening.
Okay. I've been following silently and I enjoyed the class. So my question is, you said the philanthropists like Bill Gates provided malaria vaccines. And sorry to say, but this is the first time I'm hearing of malaria vaccines. Are they in use? I want to know if they are in use.
Okay. Anyway, Bill Gates was one of the founders of the malaria vaccine. And of course, it has been licensed for use in human population. And they have started in Nigeria with Bayelsa and I think Kebbi State as the pilot states. So it's not available nationwide, but it's currently being used or being administered to children in Bayelsa State and Kebbi State. Okay, so that is that.
Oh, all right. Yes. Thank you, sir.
Hello, Precious. Precious.
Hello, good evening, sir.
Good evening.
Good evening, Prof.
Good evening.
Thank you so much for the class. Thank you so much for the class, sir. So I just want to be clear on something. You talked about the practitioners that helped to show that microorganisms were not the only cause of these diseases. You talked about John Ling, and you mentioned John Ling.
Yeah.
The one that helped to discover if scurvy, yes, was the yes. But I want to be sure. You said John Ling, but on the slide, it's James Ling.
Okay, James
so I want
Ling.
to be sure of.
Sorry.
Oh.
Sorry, please.
Okay, sir. Okay.
Yes, yeah.
Thank you
The
very
slide
much,
is
Prof.
is the accurate one. Sorry.
Okay, Prof. Thank you very
Yes.
much.
Hello, Rosemary. Ejusa. Hello, Rosemary. Hello, Rosemary. Okay. Rosemary not responding. Anyway, we are going to just quickly go through the history of public health services in Nigeria so that tomorrow we are going to finish with the ethics part. So, okay, I'm sure that issue is coming up, but the network. Okay, so talk about the history of public health in Nigeria. Public health didn't start. Public health services didn't start with the British colonial government. It didn't start with them. It started in our traditional societies. And of course, we met the chief priests. The chief priests were the public health practitioners, and they were responsible for, their responsibility was to control epidemic diseases in the traditional societies. Of course, we know that most of the reasons given were mostly supernatural, the wrought of the supernatural, and they acted along that line. Providing sacrifice and the rest. Okay, so but when the British came, no, madam, please, we have moved on. Please, your network is poor. We have moved on. Madam, we have moved on. Just hold on until we get to the next bus stop. Thank you. Okay. So so when the British came, in fact, we must say that they relied on the discoveries of that time to succeed. Because at that time, the causative agents of malaria has been isolated. thanks to the funding provided by Rockefeller, and then other diseases. So, and of course, the preventive measures, they got, of course, they became aware that quinine is curative, and they were using it liberally. In fact, Lord Lugard, I'm sure that a lot of us will recognize him. When he wrote his memo, he actually acknowledged it. His memo was called the Dual Mandate. The Dual Mandate. He said it is primarily due to medical research and to the zeal of the health medical officers that the wonderful disease, decrease in mortality amongst Europeans in West Africa is to be ascribed. So they relied on these discoveries to succeed. They relied on these discoveries to succeed. And they implemented public health measures. First, to the endemic diseases. That is, diseases that are endemic in our communities, or in our communities, of which they don't have immunity against, like malaria. So they implemented public health measures for them. They also have public health measures for epidemic diseases that started, the outbreaks of diseases that became very, very frequent because of the ease of transport and peace and connectivity provided by the British colonial administration. So for the endemic diseases like malaria, they use three main methods. The first one, they use personal protective measures. The second one is that they created government residential areas, which was effectively their place of refuge from these epidemic diseases. And then they use environmental sanitation. For personal protective measures, took quinine on a regular basis. They took quinine on a regular basis. They wore long sleeves. They built duplexes with the bedroom upstairs, because they believe that the higher you go, the lesser the mosquitoes. The higher you go, the lesser the mosquitoes. And they netted their rooms. Both the windows and even the doors were netted. And in an era where they didn't have insecticides, they routinely employed young boys and gave them responsibilities of killing the mosquitoes while they slept. So the young boys were effectively their insecticides. Their responsibilities were to kill the mosquitoes. But they trust the British. They want to make sure. I'm sure that they would have adopted a quality control measure to ensure that the boys did their work. Perhaps they have to show the number. They have to show the mosquitoes they killed in course of the night duty. Okay, so they did that against mosquitoes. And for abdominal problems like diarrhea, they actually relied on the strong gin. They rely on strong alcoholic beverages like whiskey as a way of treating abdominal ailments, because they thought that they were sufficiently, those whiskey and those strong alcoholic beverages were sufficiently powerful prophylactic against the water animals and other impurities. So they believed. Okay. And then the GROs they created GROs and actually specified in their protocol, in their protocol of colonization, they actually said segregated the European quarters, which the European quarters were the GROs and the native towns. And they said they actually gave according to Lord Doga, they said with this in view, new townships are divided into European and native reservations, separated by a non-residential 440 yards in breadth, cleared of high grass and shrubs. So, so they created the GRAs. They created the GRAs, built boy spotters, but they banned their servants from bringing in their children because they believed that the germs or the malaria parasites and other parasites are more in the blood of children. So that's why they call those spotters boy spotters, because even people that were married were not allowed to bring in their children, because their children were feared because they were believed to have higher levels of malaria parasitemia. Okay, so they also use the environmental sanitation, and yes, environmental sanitation, and they didn't even build. They actually built sewerage systems with sewage treatment plants, and then they banned the planting of certain trees or certain plants called the mosquito plants. These mosquito plants are plants that harbor water within them, and therefore can serve as breeding sites for mosquitoes. And they include plantain, banana, pineapple, cocoyam. All these were considered mosquito plants, and they were banned. They were not allowed close to residential quarters. So they used, but they also have measures for epidemic diseases. So these epidemic diseases were very, 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 very common. Very common because the British opened up Nigeria. They built railway. And railway provided a means of transportation. They built a railway, and the waterways were kept functional. So this increase in movement resulted in the outbreak of diseases. Smallpox, influenza, tuberculosis, especially in the urban slums. They were very, very common. Even plague, they were very, very common. So what the British did was they also had some measures, including the appointment of medical officer of health, environmental sanitation. They also created mobile field units, and then health education. For the medical officer of health, they appointed this guy, Isaac Ladipo Oluwole. He was appointed to be very, very active, to be very, very active in the African towns, very, very active in the African towns, and he was the first African to be appointed a medical officer of health in Nigeria. He was the first African to be appointed a medical officer in Nigeria, and he is currently regarded as the father of public health in Nigeria. He did a lot of things. Including the recruitment and training of sanitary inspectors who assisted him to go house to house looking for nuisance, looking for dirty environment, and then compelling people to do that. Compelling people to do that. Okay, so the colonial government also introduced the mobile feed units. Mobile feed units then went from door to door. They went from community to community, providing health services. So usually they will go carry everything in the truck. Each community, any community they get to, they will go to a public building, set up there, show film, show a health education film to attract people, and then use the opportunity to vaccinate all of them. So, and they moved from community to community doing that, community to community doing that. In fact, the cinema, or whatever, I think that was what it was called then, was a very big draw. Was a very big draw. Was a very big draw. But the mobile feed units used it as an opportunity to vaccinate people compulsorily. Then they also used the health education. Health education was used to tell people, to teach people what to do, when to do them, and how to do them, and how to prepare, how to prevent certain diseases. And they did that in outpatient clinics. They did that in schools through health education. They went door to door health visitors, and then they did a lot of health education through voluntary organizations, and of course they showed the films. The outpatient clinic, education in outpatient clinic, is still being carried out. In fact, it was started by Azik Oluwole. In health education, they went to schools. Health officers went to schools to teach, where health officers went to schools to teach people, to teach the pupils about these diseases and how to prevent them. And it was assumed that if you teach the pupils, they will go back home and teach their parents, and then they further further spreading the messages. Right now, we have health education experts who now teach these pupils. So health officers, health officers do not go regularly to school again. Yes, but when it started, it was health officers that were going to the schools to give health education. Okay, so the health visitors. Isaac Oluwale also created health visitors who went door to door, who went to probably patients that were discharged from hospital. They also went to them to provide other services. And of course, health education was also carried out a lot through the voluntary organizations. Especially the young men and young women Christian associations that were very, 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 very prominent during those periods. Then they showed films. We have gone through the history of public health services in Nigeria. I don't know if there are questions or comments. Questions or comments? Okay. It's all right. I don't know if, okay, Rosemary was trying to ask a question the other time. Rosemary, you can go ahead and ask your question.
Hello, thank you, sir.
Yeah.
Thank you, Prof. The network has been bad. It's a contribution I wanted to make. Someone was asking about the philanthropist in Nigeria. I want to add that we had the Gowan Foundation, who was in charge of malaria drugs and net. Even recently, we had net distribution from the FSH, Society Family for Health.
Yes, Society for Family Health.
In the Catholic Church.
Yeah. Okay. Well done.
Then another addiction. This global public health goods. We can say PPEs, personal protective measures, are also part of the global public health goods. Because when you protect yourself, maybe using gloves, you protect another person from taking nosocomial infection from the hospital to their homes.
Yes, I
So
hope,
I
yes.
think it's one of the.
I know Rosemary is one, but you have not seen the is it laboratory staff in my hospital. They roam about with those their gloves. So after walking on their workbench, they roam about. Eh? What do you think they are doing? They are spreading the disease all over the place.
Yes, sir.
They are spreading infectious agents all over the place. So that one is their own personal protection, while others are at risk. Eh? Anyway, don't worry, it's all right. But yeah, don't worry. It protects, but they have to be used. The gloves will have to be discarded after use so that you don't contaminate the environment. Okay. Hello, Iwu Charles.
Good evening, Prof.
Good evening.
Good evening, Prof. Thank you so much for the lectures. It's been so wonderful and highly engaging. Mine is just to get clarification on the assignments we're supposed to do on our own, the take-home examination. You said we have to upload on the portal. Is it the normal university portal where we did the admission process or LMS? Because
No, the
we're here to
LMS. I think the instruction will be made clear. It's LMS. Well, I don't know if it is it's functional, but don't worry, it will be sorted out.
It's all right, Prof. Thank you so much.
Hello, Luke Evans. Hello, Luke. Hello, Luke.
Hello, good evening, Prof.
Yeah, good evening.
Yes, Prof. Thank you for your wonderful lecture. Mine is just an observation. Just want to, because I was comparing notes with what was given to us on the WhatsApp group compared to what you're using for teaching. There are some minute differences in some of the areas. When you were talking about health education in schools, you can find that in the one you're using to teach us, but you can't find it on the one that was distributed to us. So I was hoping maybe you could actually give us this one that you're using in teaching. Thank you, sir.
Okay. Anyway, I thought they are basically different. That's okay. Well, it's all right. I will compare them and then give. Hello, Maria. Hello, madam.
Yes, sir. When you spoke about the history of public health services in Nigeria, I wonder whether in pre-colonial era, when we had the traditional systems of the chief priest and traditional healers, they also involved.
Yeah, they
in
were.
Nigeria, also involved in health education.
Yeah, their health education will flow from the passive cause of their passive cause of the epidemic. They're not going to tell you about bacteria because that is not their training, but they can tell you about that is caused by the gods. But once in a while, they can give us things that they also have meanings. What will I say now? Abstain. They carry out as they carry out. They encourage people to abstain. Yes, and anyway, sacrifice. There are certain things. When it comes to a disease, if a disease is incurable, like I would like to. I usually will look at a lot of us are Christians too. When the Israelites went to the Midianites and got infected with what people believe that was an STI, sexually transmitted infection, in a community where you don't have any means of treatment, at times it may be right. It may be the best, probably the only way that is left would be to kill them. Unfortunately, that was what they did. But I'm sure that if they had antibiotics, they wouldn't have adopted that drastic measure. So that is the thing. So in amongst the Israelites in the Exodus years, they adopted that, because if they have left it, that SCI could have spread round. So perhaps the best option in an era where they didn't have any cure would have been what they did. So in traditional societies, they do something. It's not that some of the things they do will be consistent with their costs, the perceived costs. For example, the Incas, though that led to their extinction. The Incas in Central America, they had climate change. They were having less rain, and they thought that their gods were angry, and they started human sacrifice. And they were sacrificing people in hundreds. Of course, that didn't save them. So in those Central America, you see mansions left alone, reclaimed by forests. It's because of that. Unfortunately, they didn't know that it was climate change that caused it. Okay. So thank you very much. We are going to end here today. Tomorrow we are going to talk about ethics, and then we'll say something about the law, the use of public health legislations, and that will be the end of our discourse. Let me thank you very much for your contributions. You made it easier. It made it easier for me, at least. Each time you asked questions, it gave me time to catch my breath and take a sip of water. Thank you very much. I appreciate. So we'll see tomorrow, and hopefully we are going to conclude the course tomorrow. Thank you very much, and have the best of the rest of the day.
Thank you, Prof. Good night.
Thank you so much,
Thank you, Prof. Everyone.
Thank you, Prof, for the lecture.
Thank you, Prof. Have a blessed. See you tomorrow. Thank you, sir.
Thank you,
Thank you, Prof. See you tomorrow. Thank you, everyone. Thank you, Prof.
Prof. See you tomorrow. Good night.